Okay. Well, hello, good morning, everybody. You're very, very welcome to our meeting today, the launch of the Women's Health Interest Group in the Parliament. First of all, I'd like to say that Tilly, our host for the meeting, has been delayed, but she will be coming. And Serpa as well, who's closing remarks, she's coming as well. So I'm delighted to be able to welcome everybody here today, as are the EIWH Secretariat. We have Dr. Vanessa Moore, Rebecca, May from our board, and Avian, who's down, I think she's down the far end there, and Connect IE, who are one of our supporters for years. So it's given me great pleasure to welcome you all here today, the people in the room and also people who are online. Thank you so much for coming. Today is a significant day which marks an important step in strengthening the commitment to achieving gender equity in health in the EU. And with the interest group, we hope to grow this commitment over the next months and years. And most of all, and which is so important, that it will ensure that women's voices and needs are embedded in the work of the EU Parliament and the MEPs here. Women's health has been neglected across policy areas, across the whole continuum, from research right through to care delivery. And this does not allow women's needs to be addressed in a comprehensive and coordinated manner from a policy perspective. So the interest group hopes to do that, raise awareness around different topics for women. As we all know, it's biological, social and economic conditions impact women's health women are underrepresented in clinical trials and have been for years. And there's a lack of sex and gender disaggregated data, which is so important if we want to have a good and targeted policy for women. There's also a lack of high quality care. And I think this goes back to the fact that women's health has not been considered, even in medical education. And women perform the majority of household chores and caregiving roles, which also impacts their health, and very little support for them also. So the Women's Health Interest Group will raise awareness of women's health issues in the EU Parliament, advocate for policies that improve women's health, support an EU strategy for women's health. That is what the Institute has been looking for also for a number of years, because we have the evidence base there that shows that there is a lack of positive research and policy for women. So therefore we need to have an EU strategy for women's health that brings all policies together. Excuse me, and ensure that women's health remains a policy focus. We also need to promote gender mainstreaming in all actions, activities, publications and policies. As women's health is a cross-cutting issue, it plays into all EU policies and actions. And some issues that will be covered by the interest group in the Parliament will be reproductive health, the impact of the environment and climate change on health, and EU approach to mental health, chronic disease, communicable diseases, women as carers. And the EU Pharma's legislation, the inclusion of women in clinical trials, and the EU Beating Cancer Plan. I mean, we could go on, but all policies impact women's health. So we're delighted here today to be able to discuss women's health with you and the future of the interest group and what we can all contribute to this interest group on behalf of women. So I hope you enjoyed the meeting, and I'm now going to hand over to our videos of the MEPs some of the MEPs who have supported the interest group, but unfortunately cannot be here today. So the first video is Deirdre Clune, who's a member of the EPP party.
My name is Deirdre Clune, member of the European Parliament for Ireland South. I'm sorry I can't be with you in person today for the launch of the Women's Health Interest Group, but I wanted to contribute in this way to demonstrate my support for this wonderful initiative. Throughout my career, I have focused on various aspects of women's health, seeing firsthand the disparities and challenges women face in accessing healthcare. I'm dedicated to promoting gender equity in health and believe that gender awareness should be embedded in the development of health policy. The Women's Health Interest Group is our platform to put these issues on the EU's agenda. EU legislation plays a significant role in advancing women's health across our member states by prioritising fair access to healthcare and initiatives that educate and empower women about their health. As a member of the Public Health Subcommittee, I recently spoke on the emerging crisis of antimicrobial resistance, or AMR, which is undermining the foundations of modern medicine, from cancer treatments to childbirth. The interaction of biology and sociocultural norms makes women more susceptible to AMR, and exposure to AMR is higher during pregnancy, childbirth, and menstruation. On top of this, 1 in 10 women in the EU do not have access to health services in their first months of pregnancy. And there is a lack of information regarding safe use of medication during pregnancy and lactation. This is not good enough, and we need much more research and support in this area. Furthermore, heart disease remains the leading cause of death for women worldwide, but there are stark inequalities in awareness, diagnosis, and treatment of heart attacks. And while we have seen positive outcomes following the European Parliament's report on beating cancer, there is more progress needed. Across Europe, we need to strengthen our collaboration to foster the sharing of best practices and enhance coordinated responses to issues affecting women's health, only a few of which I previously mentioned. Together, we can ensure that women get the care they deserve, building a healthier, more equitable future. And thank you for being here today, and I look forward to following the progress of the Women's Health Interest Group.
Stelios Kimpouropoulos, and he's our next video.
Dear colleagues, in the Women's Health Interest Group in the European Parliament, our mission is clear: to widely communicate the unique healthcare needs and challenges faced by women across Europe. Women have unique health needs that differ from men's. This mostly refers to reproductive and maternal health, menopause, hormonal disorders, and gender-specific cancers. At the same time, gender disparities in healthcare access persist in many parts of the world, including Europe. A dedicated group can precisely focus on these issues and take the initiatives for more efficient policies that eliminate the above disparities. Women's health is not just a women's issue, it's a societal concern. Our goal is to ensure equitable healthcare access and break down barriers that deter women from seeking essential medical care. We are committed to addressing the specific health needs of women in all ages by promoting research and education tailored to the need of every stage of their lives. We empower women to make informed decisions about their health and well-being. The improvement of access to healthcare services is needed, particularly for marginalized women. We will strive to achieve equitable healthcare access for all. Additionally, we will foster international collaboration to learn from best practices worldwide. In summary, an interest group exclusively focused on women's health is crucial because it recognizes and addresses the unique needs and challenges women face regarding healthcare. It can lead to more cohesive policies, improved healthcare access, and more effective treatments for women, ultimately benefiting society as a whole.
Thanks so much. So I'm just going to move us on to the next session, where the Secretariat of the Women's Health Interest Groups will talk about the evidence behind the group. So I'm delighted to introduce two of my colleagues. Peggy Maguire is the Director General of the EAWH. A political scientist, she has worked at the international, regional and national level over the last 25 years, highlighting the need for gender equality in biomedical research, public health and social policy. She was appointed by the Minister for Health of Ireland as a co-chair of the Women's Health Task Force. She's on the board of the WHO Academy Quality Committee and chair of the Patient and Community Engagement Working Group, among many, many other roles. And Rebecca Moore is our senior researcher at the European Institute of Women's Health. She's responsible for EU research projects, including safety of medicines in pregnancy, increasing cervical cancer screening uptake amongst vulnerable women, and also especially health technology assessment. Rebecca represents the AWH and a multitude of advisory groups, including the ECDC Advisory Forum, where she represents patients. So over to you, Peggy and Rebecca.
Thanks very much, Vanessa. So just to give you a little bit of background on the Institute, for those of you who don't know who we are, we're a non-governmental organisation. We were established in 1996, and our main objective is to promote gender equity in public health in Europe. We have, I suppose, over the years, we've tried to highlight as much as possible what the issues are in relation to women's health, main one being the lack of research in clinical trials and biomedical research in women's health. And this is very timely, I think, today, because we've waited over 60 years to have something focusing in on women's health. 60 years ago since the Treaty of Rome, it was over 60 years since the Treaty of Rome, where gender equality was first enshrined into EU law. And it was mainly an economic treaty, and most EU countries have flourished since. But unfortunately, not one country in Europe has succeeded in getting gender equality or reaching gender equality. And unfortunately, this is also reflected in healthcare. There are huge disparities and unmet needs in relation to women's health, and there has been long neglected in policy research and funding mechanisms throughout Europe. And this year, we have published our manifesto for women's health. And what we have looked at are the facts and figures and the issues pertinent to women that impact women. And we've aligned these issues with the EU legislation, because it's EU legislation that's impacting and can improve women's health at member state level. And we must ensure that all of these legislation and policies are implemented. So to date, over 28 organisations have signed up to the manifesto. And in our manifesto, what we're really looking for ultimately is an EU strategy for women's health. And because of all of these policies and legislations that have been introduced in Europe, we must make sure that they are implemented at national level, that women do benefit from them. And we have some copies in the room. I think you should already have them of the manifesto, and it's also in the chat box as well online. The Women's Health Interest Group, I think, is a really important step as we move forward towards gender equity in health. And there's been fantastic positive response from MEPs as founding members, which are across Europe and also across parties. And it's evident that women's health is an issue that trends both borders and political divides. When you look at the work of other parliamentary groups, and I think always this is very interesting, for example, there are quite a few of them, like MEPs Against Cancer, the amount of work that they have done over the years, it's evident that women's health is an issue, that when we bring politicians and civil society together and work together, number one, you're hearing the voice of the women, and the MEPs are hearing the voice of the women, what they need. And therefore, ultimately, there should be better outcomes and better policy at an EU and also at a national level. Just an example of that, in 2014, the EIWH, the European Institute of Women's Health, was working on the revision of the clinical trials regulation wording. And we tabled amendments through very supportive MEPs in the Parliament. And when we were delighted when our wording was included in the revision document of the regulation. So I think this is a good example that we should have more of this, more interaction between the politicians, and most importantly, to hear the voice of women. So the EIWH is delighted to be the secretariat for this group. And we hope we can support this group with the network that we have, with the expertise, our data on women's health, but also most importantly, the people who have, and the organisations that have signed up to our manifesto. They are representing different organisations, different topics that are relevant to women. They have a plethora of expertise, knowledge and data that they can feed in to the Women's Health Interest Group as well. So we look forward to working with everybody who's signed up to the manifesto, so we can create this critical mass of power, I suppose, and interest in women's health moving forward. So I wish to thank you all for joining us today and showing your commitment to women's health. And I think working together, we can raise awareness and make better life for women throughout the EU. Thank you very much.
Thank you very much, Peggy. So because we all know public policy affects almost all walks of life, it's the intention of the Women's Health Interest Group Secretariat today to provide you with pieces of research that we believe highlight some examples and illustrates good examples for you where this Women's Health Interest Group will actually be making a powerful contribution to change that we would like to see. My first slide, I'm just following the life course approach. I think that's an easy and logical way to present the work we've been doing. We've founded a women's health interest group, as this has been an under-prioritized group for a long time. We have had a dialogue with women's health, listening exercises, and issues that they have found themselves include sexual and reproductive health. Pain was especially something that came up a lot, and stigma, which was around menstrual health, sexual health, and mental health. And mental health, we all know, is very big among young women. We'll be continuing our work with this group, and we will be prioritizing action points and more research points. Next slide, please, Aileen. We also have a maternal health report, which has shown some very interesting facts and figures that we all know. For example, on average, 1.53 live births per women in the EU. We have, within this group, though, non-Western origin has a 60% higher rate of maternal mortality, which just can't be that way. We need to do something about it. And including this, nearly half of pregnancies in the EU are unplanned. And interestingly, 5 million babies born in the EU every year have been exposed to medication during pregnancy. And as high a number as 98% of these drugs have insufficient data on safety of use in pregnancy and breastfeeding. And we've been working on the IMI Conception Project, a 5-year project, which is a collaboration between public and private groups, industry and academia, and patient organizations. So if anyone has any interest in that, please contact us and we can provide you with more, because it's a very important project. Next slide, please, Eileen. We also have produced a very comprehensive report, A Lifetime of Caring, Who Cares? We did this together with Eurocarriers, and so we'd like to give a big thanks to Stacey Ikemonos, who is the CEO of Eurocarriers, for the work done with us, and also Professors Laberry and Kira Jennings on this report. We're talking here about the sandwich generation. It's the people raising a young family, but also looking after older family members. We can implementing the EU Care Strategy is shown to be clearly linked to enhancing the working condition for this informal and formal carers, and also respecting the rights and independence of these care recipients. Considering that women are the main caregivers and 80% of care is informal in EU, and 75% of these informal carers are women. So this is very much a women's health issue. And we hope that this report and this women's health group will be able to affect these women's situation. Next slide, please, Eileen. We also have a report on midlife and older women's health, which brings up areas that are the same in various stages of the life course approach, but might have a little bit more importance in this area. We have, for example, shown in this report gender differences in years lived in good and poor health. Cause of death are different between the genders, and we also have preventable and treatable mortality. We've the report found and identified priority issues such as cardiovascular disease, cancers, mental health, and neurological disorders. We also have steps for actions that are outlined in the report, and we'll be working on these steps in the coming year. So this is another interesting area. But what we have chosen for you today is to run through these presentations, and this is a work that's currently in progress, but we know it's going to be very helpful for the EU Parliament's Women's Health Interest Groups, and it's already provided us with some very rich insight. And it's the hope of the Secretariat that this work, the mapping of good practices in women's health across Europe, will provide a blueprint, and that it's going to become the go-to document for policymakers and anyone interested in advocating women's health in their countries or regions, as it provides a rundown of the best practice examples in the various EU countries. So we've selected 8 European countries: Austria, Belgium, England, France, Ireland, Scotland, Spain, and Sweden. And 4 of these countries, Austria, England, Ireland, and Scotland, have current action plan strategies which cover the broad spectrum of women's health needs over the life course approach. And the other 4 selected countries, Belgium, France, Spain, and Sweden, have specific targeted plans in certain areas of women's health, such as domestic violence, sexual and gender-based violence. So we'll be happy to be sharing this with you very soon when it's finished, and hopefully it will be making an impact. And finally, my final slide, just to let you know that we have other areas, obviously, that impacts women's health. This was just a snapshot. And with policy briefs on our website that you can access if you have any more issues that you're interested in. Thank you.
Thanks so much for that. Just in the interest of time, because we don't want to fall behind, we're going to skip the 2 next videos that we were going to play, and if we have time, we'll play them at the end. And instead, we're going to move on to the next speaker. I'm delighted to introduce Dilly O'Brien from the Department of Health in Ireland. She's a principal officer there, where she's the current lead of the Women's Health Programme, and she's the head of Policy Strategy and Integration Unit. Dilly has worked in various policy and legislative areas in the Department of Health over the years prior to her appointment in January this year to Women's Health. These areas include governance, health promotion, disabilities, tobacco legislation, and child welfare and protection policy. Go ahead, Dilly.
Thank you very much. Thanks, everybody. And apologies for being late today. Just want to thank Peggy Maguire and the European Institute for Women's Health for inviting me here today. I'm delighted to be here at the launch of the Women's Health Interest Group. And I think I've been invited here to talk about Ireland as a model of good practice in what we've done in the area of women's health. So just to move on there to slide 2, please. Thank you. So in Ireland in 2019, we set up the Women's Health Task Force. This was following on from a report at a time maybe when there was a bit of a dent in the confidence of women in health services in Ireland. And there was a push from a government perspective to build up that confidence again. So the Women's Health Task Force was set up in 2019. And that report that recommended it wanted to focus that women's health issues be given more consistent, expert and committed attention. So there was a very broad recommendation from that report. So we were looking at how we'd move this on, and I suppose from all government department perspective, you could say we set up a women's health unit. That might do it, but no, that won't do it, because women's health spans across all services and all areas in the department. And also we wanted women's voices to be very strong. So the idea was we set up a women's health task force, and with the ultimate objective of improving women's health outcomes and experiences of healthcare. Next slide, please. Thanks. So what is this task force that we set up? So it's representative of policymakers from across the Department of Health. It's co-chaired by Peggy Maguire here, and our Chief Nursing Officer is the other chair, Rachel Kenna. It's a very unique way of working. It's a collaborative way of working, open policy making, co-designing services together. It has clinicians and experts, and it has officials from other relevant government departments. So that's what the task force is and who's on it. It's quite a large task force, and it is representative of all those areas. Next slide, please. So the task force set to work, and the first thing they wanted to do was really listen to the voices of women And again, like I said, there was a bit of a dent in that confidence. Women maybe felt that their voices weren't heard. So the task force set about doing a radical listening exercise. So it did this through workshops, through focus groups, meetings, webinars, emails, social media platforms, across all ages, across different socioeconomic groups. And the task force very much wanted to be active listeners to the women of Ireland and what they were saying about their services. So it wasn't all bad, I suppose. There was positive results about maybe maternity care and also the relationships that women had with their GPs, where they felt they had good relationships and they were advocates to them. Some, I suppose, of the more negative feedback was that women often felt rushed and unheard, maybe unsupported and dismissed in some of their interactions with the health services. They often felt that communications was poor and there was a lack of information for them on issues that were affecting them. So the Women's Health Task Force listened, and on the basis of this listening, we had the foundations of our Women's Health Action Plan, which we published in 2022. It's a 2-year action plan. And this action plan very much an opportunity to spotlight some priority issues that women raised with us. Next slide, please. So the action plan has a framework built into it, which is listen, invest, deliver, and repeat. So I've spoken a bit about the listening and what the Women's Health Task Force does and continues to do. By the way, we continue to listen to women through various ways. And we're just going to go into a bit of the investment now. Next slide, please. Thanks. So I think we're lucky since the establishment of the task force in Ireland that we had a very strong political support, both from a ministerial perspective and a government perspective in the area of women's health. So there has been significant investment in recent years in women's health. Next slide, please. Thanks. So I'm going to give you some examples of the things that we've delivered, the next part of the framework. So listen, invest, and deliver. And these are just a quick run through of some of the aspects that we have delivered on in the last couple of years. So we've implemented our national maternity strategy, which has developed our community midwifery services, breastfeeding supports, training and education supports for staff. We've opened postnatal hubs in the community with 2 open and 3 more currently in development. We had a launch of our free contraception scheme. So we have free contraception now for everyone from age 17 and rolling that up to age 31 in next year. Next slide, please. We also, one of the big issues that came out for us from the listening was menopause and the stigma and taboo around menopause and how there was so little information about menopause out there. So we did a government national menopause awareness campaign. And then last week, I'm delighted to say that the civil service launched their menopause in the workplace framework, which will be implemented in all government departments and public bodies by end of quarter next year. We did a quick reference guide, funded a quick reference guide for GPs to give them a little bit more information about menopause. We have a web page. We removed VAT from HRT products. Another initiative was the opening of the See and Treat ambulatory gynecological clinics, bringing it to a total of 14. We opened 6 regional fertility hubs, and last year we started the public funded IVF treatment scheme as well. Sorry, next slide, please. And we also, endometriosis was another issue that women wanted more information on and more services on. So we have developed 6 regional endometriosis hubs, and we are currently, there's a framework for endometriosis that is being finalised currently at the moment and hopefully will be published before the end of the year. There's further development of the sexual assault treatment units, and we have started to tackle period poverty for the first time. We removed VAT on the products, and also we introduced various initiatives in consultation with our local authorities and NGOs in relation to period poverty. Next slide, please. And just to say that obviously a lot of health services is funded through Exchequer and through the budgetary process. But as part of the task force work, we got access to a fund, a women's health fund. It started off as 5 million, ended up then as 10 million. It doesn't sound a lot in the great scheme of things, but what it did do, it enabled an awful lot of initiatives to get off the ground quickly and innovatively. Sometimes services development get bogged down in bureaucratic and a bit slower process recruitment. So the health fund managed to actually speed things up a little bit. So once they got off the ground, then they continued to run and they were embedded and they got recurring funding every year. So it's a very, very good mechanism of getting things up and running quickly if you wanted to spotlight a few issues. And menopause, the specialist menopause clinics that we developed were funded from that, the postnatal hubs, etc. And we had various research and different mental health pilot projects as well underneath that fund. Next slide, please. So next steps really for us and the task force. So as I said, our action plan is a 2-year action plan. The task force continues to meet regularly. Our focus at the moment is what's next for us, our next phase of what we do once our action plan comes to an end at the end of this year. We want to continue focusing on listening to women, and we still do that through our webinars and emails, meetings, experience surveys, and various different methods. The task force has a huge role in influencing and advocating. And one of the things that we want to do is that we've had 2 years now of the action plan and the funding. We really want to see the impacts of that and measure the impacts of it. So we're doing a progress report to see how we got on with our 10 broad actions in the action plans, but they're obviously broken down then into smaller sub-actions. So we're going to measure how we're doing and maybe do an analysis of women's health outcomes. So we're doing a bit of an analysis on that at the moment. Obviously, through that analysis, we'll discover probably data gaps where we can't see where we've had an impact or a positive impact, but we're hoping to pull all that together. And just really to say that we are lucky at the moment with our political support. We know that in the future, priorities change, political priorities change, resources maybe become less available to us. But I think the structure of the task force allows us to move forward in a way that we can continue our work, even in times that maybe the resources aren't available. There's still a lot of work that we can do as a task force to keep the momentum and keep the priority on women's health. So that is our focus. Our focus is the task force and to continue to keep women's voices at the centre of our policy making. Thank you very much.
Thanks so much for that. Just to say as well, there'll be some opportunity later to ask questions of our speakers, but just in the interest of time, we'll move on to our next speaker, who is Sylvia Geiswinkler. She's a sociologist and senior health expert and has been working as a project manager and recent research assistant at the GEG since 2015 and in the Health Society and Equal Opportunities Department since 2021. Since 2022, she has been responsible for the Coordination Office for Women's and Gender's Health, and since 2016, she has been coordinating the strategic process for implementing the Women's Health Action Plan, and since 2019 as the national focal point for women's health. Over to you, Sylvia.
Thank you for the introduction. Thank you for the invitation here. Next slide, please. Austria has an action plan on women's health with 70 goals and 40 measures. It was initiated already in 2015. Also, as we heard before, with a lot of political support, in case here with the Minister of Women's Affairs then. It was a long process with intersectional stakeholders and actors, cross-political, and with 4 expert groups on different life phases of women and girls, and around 50 organizations around whole Austria. We also did the action plan on the life course approach and with life phases of women for young, for middle-aged, and for older women. Next slide, please. The action plan was presented at the first Women's Health Dialogue in Austria in 2017. It got a cross-party approval, which really helped a lot for the structure, for the implementation structure in Austria. The structure is based on focal points. We have in each federal state a focal point for women's health. We have focal point meetings at least 3 times a year. One time a year, we have a women's health dialogue. It is sort of conference already in the meanwhile, and this structure is mainly a networking structure. But we see it helped a lot to start activities and to focus on points that are important, and what we also hear from the federal states, what are the experiences in praxis with women, and from different groups, also with vulnerable groups of women. Next slide, please. One activity that resulted from the action plan is somehow the Women's Health Report. We did it in 2020. It is the first report after more than 10 years. It provides information on the health situation of girls and women. I also want to mention here, we explicitly pronounced that we did the health report also on girls, because health starts with a young age and not with an older age. The topics are included that are hardly or not at all covered in common health reports. Next slide, please. The key findings are, we were curious by doing the report, still 51% of the population are women and girls, but still we had a really highly challenging data situation on specific health-related topics for girls and women. We have a high correlation to what you already said before: menstrual health, menopause, sexual health, reproductive self-determination, different life phases, and all the burdens that occur because of them. The health impacts of, so as we also heard before, unheard women with health in healthcare services, and a lot of other topics. What is striking? It is there is somehow existing data, but if it exists, it is very focused on reproductive health. What we recognized, there is definitely historically androcentric view in the healthcare system. And next slide, please. So one of the recommendations is to shift the perspective in healthcare to women's and girls' health topics, and also burdens girls and women have. That means we need women-specific indicators in health planning. We need women-specific indicators in data generation, and also in health services. There is also a point to target focus on current developments, like how is the development right now in digital health and AI systems. We have here a gender gap, and it gets stronger, and I guess it is a focus we should do here. What we also recommend is to integrate women's health experts in decision-making bodies, and this means really experts that have experience on women's and girls' health. Next slide, please. What we also do, and this is also somehow a result of the action plan, because it comes to actions, that is also what we see because of the action plan. We are doing a survey on menstrual health and menopause right now, representative for Austria. It is also inclusive endometriosis. We have a LGBTIQ plus health report, and also are implementing now LGBTIQ plus measures for awareness raising in the healthcare professional jobs. We have a gender equity plan for implementing in diverse projects. We did the 6 Women's Health Dialogue on self-determination for women and girls. And we are doing a survey, a study on contraception in Austria, because Austria has a rather low contraception policy. That's what we are doing. What we also see, I want to close now, is the action plan is for women's health is one of the tools that helped a lot to structure the issue, and also to support the network, and to raise projects we had done now, and we are doing hopefully in further months and years. Thank you.
That's great. Thank you so much, Sylvia. So at this stage, I just want to see if there are any questions from anyone in the audience to either one of our speakers. Oh, please, yeah, go ahead.
Well, thank you so much for the really interesting presentations. Also, congratulations indeed to the launch of the Women Interest Group, because I think this morning shows, and also data that you showed, how important the topic is. I think my question is about how to get broader support than just, let's say, in the public health community about the importance of women's health, because I think the examples from Ireland as well from Austria shows that women's health is impacting by much more than just health factors. It's about climate policies, about employment policies and whatnot. And how do we make sure that, again, the interest in the topic, and perhaps it's also a political question to MEP Tilly Metz, doesn't really remain in the health area, but also goes beyond that. And also noticing that we only have few men in the room. Again, how do we get that broader support?
Do you want to go ahead, Tilly, and answer that? Or Dilly, maybe first as well?
Yeah, sorry, I don't know if I'm pressing the, no, this one, yes. So from an Ireland perspective, there was a national women's and girls strategy. I think it's past its date now, but they are doing a brand new national women's and girls strategy again. So it'll be very important, obviously, for us to be at that table from a women's health perspective. But I agree with you; it's a broader cross to government and cross departmental issue. So from an Irish perspective, we do feel that it will help that aspect, because it will be a cross departmental development of that strategy.
Does any other of our speakers want to come in on that, or Tilly, go ahead.
As for Austria, we see what really helps is to have strong partners. We are lucky in Austria because it's rather small, and there is in Vienna a lot of work already for decades on women's health. So this is a really strong partner, and to do the network and to really take it serious, to do the network all over the country and with different partners. And so to get the awareness into more and more people, there are 51% of the population women, and they have different problems than men. So it takes time, I guess, but somehow in Austria we see it works somehow. I mean, till now, also political situations can change, of course.
Yeah, good morning, everybody. And first of all, sorry to be late, some train issues, but I'm very happy to be here. I think it's a very important moment. And just to react also to, first of all, to this question, indeed, what we need is really a holistic approach and really tackling different sectors, and especially as we see also women on both sides. They are now a target group because there are a lot of issues, problems that are ignored or not addressed at all, and specifically also not at the European level. But on the other hand, and you showed it because I was lucky, it allowed me in the train to listen to the presentation. You also mentioned very well that women are also at the large part on the other side, so as caretakers, which brings again another sort of specific problems that we need to tackle. So yes, I think really raising awareness, but it also starts during training, that we have more professionals really that are also trained in the specific issues, but also on communication. I think it's important to have the different professionals on board and the different sectors. So it needs a lot. It needs really on the health, specific topics, but also how we can have in the different sectors all the actors on board in order that it really gets an issue, as you very good said. It's not only about health, it's about employment, it's about work-life balance, it's about family organization. So there's a lot to tackle here. And I think it's very important, as I said, or sorry to repeat myself, also to do it in training and campaigning and raising awareness in order to have really more actors. And I'm very happy to see so many women, but somebody said it already. It would be important to have also more men. So I was happy that amongst the MEPs, there are also some men that are defending this. So thank you again, and happy to be here. I think it's a very important moment that we have today at the European Parliament.
Thank you so much. Thanks a million. Were there any other questions? Yeah, please go ahead.
Thank you very much. A very quick question regarding Austria, because I heard you were saying poor contraception policy. Can you just expand what you meant by this? Thank you.
Austria doesn't pay any part for contraception for women.
That was indeed brief. Thank you. Please. Oh, sorry. Which one was first? Do you want to go ahead? And yeah.
Yes, good morning, and thanks for having this event. Very nice to hear about the initiative and also the best practices already happening in these countries. I'm from the European Disability Forum, and we know from our own research and working with members that persons with disabilities face really complicated barriers to access to healthcare, and then some unique ones such as forced contraception, forced abortion, and forced sterilization. So I'm curious, particularly, I'm glad to hear Tilly say that there will be an inclusion of larger stakeholder groups, and we hope to be a part of that. But then as well for Austria, from the representatives from Austria and Ireland, what you've come across in terms of best practice in data collection for disability, women with disability, and then initiatives, if any. Thank you.
Yeah, so from there is representatives from the disability groups that are on our task force, and very much a focus on, I suppose, is a general catch-all heading of marginalised women, but disabilities is encompassed in that. And I suppose our action plan spotlighted a number of issues, and maybe we haven't dug down deep enough yet into the whole disability areas. And I know there are data collection issues in Ireland in relation to disabilities. It's something I think that we hope to focus on in further phases, to focus more on. But definitely the voices of women with disabilities were captured during our listening process, and we're very much aware that their presence is an essential element of our task force.
Thanks very much. Sorry, so with one question there and then one over there as well. Sorry, do you want to go ahead with your question? Oh, okay. Brad, do you want to go ahead then?
Yeah, hi, Anne Wagenfür from EuroHealthNet. I have a question for Ireland because I found it interesting, the Women's Health Fund, the special fund you mentioned. I didn't grasp the amount you were mentioning, and then where does the funding come from? Because I think it's interesting to speed up special initiatives and have maybe lower administrative burdens, but I wondered, maybe you said it, but where does the funding for this one come from? Thank you.
So I suppose from a health service overall funding perspective, it is a small drop in the ocean, this fund. So it was 10 million. And bear in mind, I suppose our health services are funded to 22.5 billion this year. So it is small. However, it has enabled an awful lot of initiatives to get off the ground. So the funding comes from the Exchequer. It was just a funding that was ring-fenced and given into the Department of Health to be administered by a group, a Women's Health Executive Group. So we receive applications, we scrutinise them, go through them, and then we award, if that's the right word, we allocate funding to various initiatives. But I think a lot of the initiatives, for example, there was the specialist menopause clinics. Even though the funding was given to them, that funding then is incorporated into the health services base. So it's recurring then after that and built on. So it's not a one-off. Some initiatives were one-off, research funding, different things like that, but some were services that were built in and were recurring. So even though it's a small fund, it had a big impact.
So I'm sorry, we've very little time left. And look, if you have any questions, we'd love to answer them. So please contact us and we'll answer all the questions that haven't been addressed. Really apologise. We have our two MEPs here now, the hosts, Tilly and also Serpa. So we'd like to give the opportunity to Tilly and to Serpa to say a few words because we've only got 3 minutes left.
Serpa, you can start. I said already something.
Thank you. As you can see, we are in very good terms with Tilly, and happened to be so that we run together in many of different kind of events, so our interests go in line. Very happy to share this event and course with you too. But then, first of all, I would like to thank very much the organizers, not only because of this event, but sort of raising this topic, because we urgently need more more awareness, more specialized knowledge and mapping what is actually women's health and what the EU should do. I've been around this issue for more than 15 years, and it is actually astonishingly, breaking news for you, men and women are different and all the genders are different in between, but that is not being taken properly into account. Of course, it is sexual and reproductive health, it is menopausal health, but as you know, starting from stem cells, we are different. So it means that the medication has different impacts. And usually over this test with young men or working age Caucasian men, and guess who is eating the medicine? Postmenopausal over 70 women that are represented on that age class that didn't even exist on the testing methodologies 10 years ago. And I know that you and we fought quite hard to get it there. And then, of course, it is many other issues. Understood symptoms of common diseases like diabetes, heart attack, you name it, that just give different kind of symptoms, and they are just not recognized. And I guess the classical famous example is the heart attack, where men and women have very different kind of symptoms. And then I guess what is the outcome of this? Women have much more higher numbers of psychological diseases. And I'm just wondering, I can't say because it has not been studied, how often it happens that it is this sort of a middle-aged woman who goes to a doctor and says, I really don't know what, but something is not okay. Then when it is not identified, and everybody knows that there's the risk that the symptoms are psychology-based with women, according to statistics. Well, then here you have again one example more on the statistics. So you go in the circle, you cause presumption and under treatment. And then, of course, it is those diseases that are much more prevalent, like osteoporosis among women. And I bet I know less than 5% about the whole thing, so the tip of the iceberg. And the question is, what can we do to raise this issue on the political agenda on EU and on our member states? And I think that we would have a beautiful possibility before the new commission to sort of kick it on the old commission to start preparing, not deciding, but preparing a roadmap, a strategy, a blueprint, whatever you wish to call it, of women and health, or women's health. And that should start from A to Z. That means research, funding, specialized doctors and clinics, and then sort of a mapping and education of the doctors, nurses, and then we know that women aren't represented because they are poor, especially when they are on pension, in cancer screenings, for example. So there's a plethora of issues we would need to identify, and this is not only a political text someone could produce, but I think that we should engage researchers and make it a proper attempt to see what needs to happen. And then hopefully this group could continue on the next parliament and really kick sort of a energy on the topic by writing reports, posing questions, raising the issue, and guaranteeing the funding also, so that we really could get the awareness and better healthcare for the women too. Thank you.
Thank you very much, Serpa.
No, because I was already told that the next event is already waiting outside, so we have really to leave the room. So this is only the beginning. I mean, we still have some months until the elections, and even after the election, I'm touching wood that I'm still part of it, we will continue. And I think even after the next election, if you look how it's going in Europe, we need even more this intergroup then. So it's really just the beginning, and let's go outside maybe for some networking, but otherwise write to us, and we keep in contact. And I feel fully commitment, and Sirpa explained everything so well also, and all the input that we got, how needed this interest group was, and that we need this approach and also political, to make it a political priority. And that is going to be one of my fight for sure in the future. Health and women, they are so much missing that we need really to fight for it. So thank you very much again. And as I said, I think it's an historic moment for women and health here in this European Parliament today. So thank you very much. And we really have to leave.